Today we're joined by Dr. Francisco Garza Salinas, a family medicine physician with South Texas Health System Clinics. Thank you for joining us as we talk about some of the important issues that affect Latinos, not only nationally, but right here in the Valley. Some of those issues, obviously, there's one big one that we see a lot of, unfortunately, and that is obesity. Latinos are 1.2 times more likely to be obese than non-Latinos, and that can obviously lead to other issues, including heart disease, stroke. Tell us a little bit about that, carrying all of that extra weight for a long term and how that affects the body.
Yeah. So definitely obesity is one of those topics that we always talk in the office. Some people can be overweight, mildly overweight, obese and severely obese, but it's something that, that we need to talk about in order to, we have to know that we have options. And obviously, the more weight we carry, the more our risk of diabetes, kidney disease, and heart disease as well. But yes, it's a very important topic that we always have a conversation in the office.
And you have a BMI and people body mass index. Tell us a little bit about what is that BMI and how important is it for you to be paying attention to it?
BMI it's been around for a long time. It's more than 50 years. But basically, it calculates your height and weight ratio. So even somebody that can be perceived as underweight can have an abnormal BMI. So yes, the numbers are important, but sometimes there's other options, other things that we look at. Your hip ratio, and overall, waist circumference is more accurate. But the BMI is the way we measure it right now. But basically the advice for me is don't concentrate too much on the BMI. Let us evaluate you in other ways as well.
All right. And now another issue that we see is hypertension or high blood pressure. It's really common here in the Valley. Approximately 1 in 5 Latinos have hypertension nationally. Many don't even receive the treatment. How important is it to get that treatment and to just make sure that you keep your blood pressure in check?
We can have high blood pressure in kids. So, we start screening in young kids at the age of 3. And then every year during your physical, we also monitor your blood pressure. So, it's something that can start early, but you have to diagnose it early and treat it early. As we get older, obviously, it can affect our kidneys, it can affect our heart, it can affect overall our general system. But the best way is let's kind of detect it, and then we can do something about it.
And that leads us, obviously, you talked a little bit about kidney disease. So Hispanics are 1.5 times more likely to have kidney failure compared to non-Hispanics. And that coupled with diabetes, which Hispanics are 17% more likely to have type 2 diabetes than non-Latinos. Let's talk about the kidneys and how important the function of the kidney is and making sure that we're taking care of those kidneys.
The kidneys are very important. After the age of 30, physiologically, we lose about 1 to 2% of our function. That's normal. When we add diabetes, hypertension, high cholesterol, and then certain medications, it kind of becomes a perfect storm, for your kidney to kind of those numbers to decrease over time. The key is you gotta detect these medical conditions early, and also we have to emphasize the importance of exercise. And try to increase our water intake. So there's other little things that can affect our overall general health of our kidneys. But again, the only way to detect how the kidneys are doing is by a blood work. And that's when we do that through our annual physical every year.
And I think with all of these conditions that we're talking about here, one of the key issues that we find is that Latinos don't go to the doctor. And they self-medicate, and we do all of these things. I'm a Latino as well, so I know I've probably done some of these things, and maybe I should have gone to the doctor, but how important is it to go and visit your doctor and do that regular checkup, or go and see somebody if something doesn't feel right?
Yeah, so let me start by saying, it's a credible fear, right? I mean, I don't like to go to my doctor. I have a doctor myself, even though I'm a physician. And I don't like to go. But at the same time, he's become my friend. So at the end of the day, we're not there to push medications, but at the same time, we're just trying to improve your general health care. My dad is diabetic as well. He comes to see one of my partners in the office, and it becomes a big family. So, you know, everybody's afraid of taking that step to seeing the doctor, but it's one that we all have to take at some point.
Well, thank you so much for joining us today. We really appreciate it. We'll be right back.